Hi guys, welcome to my channel. My name is Priscilla Kumah. I'm a registered nurse based in the United States. I am in New York State. I come from Ghana and I was a nurse in Ghana and I'm a nurse now here. My channel is about nursing, lifestyle, travel, and anything else you can see. I do some cooking and a lot of hot seats and interview people. So today I have someone on the hot seat and it looks like I'm now in Europe, even though I'm still in America. I've had guests that came all the way from UK onto the show via Zoom. That is, before I forget, I'm padding the picture quality and the sound quality and padding my voice. I'm not feeling my best today, but we're going to get this done and the information you need will be here. Are you a mental health nurse in Ghana, Nigeria, Kenya, Tanzania, any part of Africa or Asia, and you want to work in Europe, you want to work specifically in UK? Okay, I have a mental health nurse here on this channel today. She's going to tell us the journey, what you need to be able to practice as a mental health nurse in UK, even though you didn't school in UK. Hi, Jocelyn, welcome to my channel and introduce yourself.
Hi, Priscilla. So my name is Jocelyn Boateng. I'm from Ghana. I'm currently living in the UK and working as a nurse, a mental health nurse precisely.
Wow. It's been a while. I'm glad to have you here finally.
It's been a long time.
I know. Don't worry, I'm going to come over. I have to visit Europe. I have to be in UK specifically because I have so many friends out there. So you are a nurse in UK. You want to tell us let's go back briefly to Ghana. You schooled in Ghana. Which mental health school did you go to? How long was your study? And when you finished, what were you awarded? Diploma? How was the study in Ghana? A brief summary of your mental health journey in Ghana.
Okay, so I schooled in Ankafo, which is in Cape Coast, Ankafo Nurses Training College. I did it for 3 years, and at the end of it, I was awarded a diploma in mental health nursing. So from Ankafo, I did my national service, which is a rotation. And then I began to work for a while. Then I moved to England. Okay. So that's how it has been.
So I believe after your studies, you wrote the licential, that is RMN.
Yeah. So after my studies, I did my license and exams. Then I got my PIN. I think I got my PIN in 2015, 2016. And then I began to practice a bit. Like I said, the national service and then the rotation, as it's called. Then worked for a while, and that was it. I did my OSCE, my CBT. Then I moved to England.
So just a quick one, what made you choose mental health nursing? Because you could have done general nursing, you could have done midwifery. Why mental health nursing?
So that's a good question, Priscilla. I never intended to become a mental nurse. I really never wanted to become a mental nurse, and that's my truth. So one day my auntie said to me, do you want to consider mental nurse? And I said, hell no. Why do you want me to become a mental nurse? I don't want to become a mental nurse. And then she said to me, when you do mental nursing, you could equally practice as a general nurse and become a mental nurse. I said, no, I don't want to be bitten by a mentally ill patient. And then she said to me, the mental patients are actually scared of the nurses. That was one thing she said to me that got me like, okay, tell me more. So I didn't want to become a mental nurse, and that's it. That was just it. I actually applied for a school in Koko, and I was denied. So I didn't have any alternative than to go to Ankafo. I ended up in Ankafo, but I can boldly say that I haven't regretted becoming a mental nurse. I mean, I would encourage people that feel like me to also give it a try. You never regret it, really. You wouldn't.
Okay. So that was just, that was the response I got after speaking to a few mental health nurses that were my colleagues back in high school. They were like, they never intended going to mental health nursing. They got there by chance, but at the end of the day, they don't have any regrets. So I'm glad you don't have any regrets. I'm glad you're doing what you love, and I'm glad you're helping people. So let's just fast forward a little bit. So you got into UK on your own, not through the agency. How was that process like? You traveled there by yourself before you started your process whilst living in the UK, correct?
So I don't want to go much into it, but then I got into the UK via like my family.
Mm-hmm.
I did an application somewhere, and I started actually doing my applications in like 2005, and I got refused. I kept getting refused like for the visa and stuff. So I had an appeal done in 2016, 2017, and that's how I managed to get here. But then I came via my family. It's my family that filed for me to come into England. Yeah. So fast forward, when I got to England, I practiced I actually worked as a healthcare assistant for over 2 years. Yeah. And then I finally decided to do my OET, which is the occupational English test. Before you'll be able to practice as a nurse in England, the NMC requires, the Nurses and Midwifery Council requires you to pass an English test, which is either the occupational English test or the IELTS. I decided to do the occupational English test because it's more or less like nursing, which I felt very comfortable to do, even though it's not easy. I mean, it's something that is doable. So I did my occupational English test, and then I did my CBT, which is a test of competency, part 1, test of competency. And then I did my OSCE, which is the objective structured clinical examination, which is the part 2 competence exams. And then I registered with the NMC, and I go onto their register.
So the OET, is it for just mental nurses or is it for general nurses?
No, OET is for everybody.
Okay.
Everybody that wants to get onto the Nurses and Midwifery Council's registration, whatever. It's for everybody. It's just an English test that is accepted by the council.
So in place of OET, can one take IELT?
Yes, so you can either do the IELTS or the OET. But then I was comfortable to do the OET because I felt it was nursing related, which made it a bit easier for me. I mean, comparing it to the IELTS exam.
So the abbreviations are a lot. So you OET, then CBT, then OSCE.
Yeah.
That's
what I did.
Okay, is that the same part for general nurse, or is that for just mental nurse? OET, CBT.
Oh, it's the same for everybody. Mental nurses, general nurses, midwives. It's the same for everybody. But when it comes to CBT and OSCE, I believe we do different CBT and different OSCEs. I mean, if I'm a mental nurse, the kind of things I would do, a general nurse wouldn't do it, and a midwife wouldn't also do, I believe. So the pattern is a bit different, but I mean, same examination.
So for the CBT or IELTS, do you need a study material? Do you need to go to a class? Did you study on your own? How long did it take you to get your CBT ready?
Okay, so I'll start with the OET. I had never taken OET test before, and I didn't know how it looked like, even though I had gone onto YouTube to see 1 or 2 stuff. I had problems with the reading, and I thought I needed somebody to teach me. I embarked on a training, but it wasn't helpful at all. So personally, I would say that if you're doing such things, you should sit your bum down and learn. I find that helpful rather than getting somebody to teach you. I got a tutor that taught me. I paid for it and everything, but it didn't really help me, I must say. So I did my personal studies. Actually did the OET once, and I failed in reading. So I had to redo it again. I spoke to a friend that said to me, do you want to sit your bum down and study and leave all these teachers and that teacher and this teacher? So I said, okay, that's what I'm going to do. I then began to study. I realized the reading was my problem. I didn't know, too much. So I began to learn more about the reading, but then I subsequently passed. I believe it's the same thing like the IELTS. Somebody can give you the tips and the tricks, but then if you don't sit your bum down to study, you wouldn't make it. With the computer-based exams, It's nothing at all if you ask me, which is the part one of the competency test. It's nothing at all. If you're a nurse that have practiced before, you should be able to know certain things. And you don't need to know too much. Just read a little, and it's an objective question, really. So you don't know too much. You don't have to know too much to pass. So if you ask me, I think the CBT is nothing at all. It's something that you can easily pass. You can just be in bed, wake up, and then be able to solve CBT questions, if you ask me. Yeah.
So what is the score? What points or mark do you have to get before they say you've passed your CBT?
I'm not too sure about the mark. I've actually forgotten. But you don't need too much, really. And it's not something that you will fail. No, I don't think. If you ask me, I think it's the English that needs a lot of concentration. It needs, plenty of concentration, because it comes in four modules: the reading, the writing, So if you don't concentrate, you might get 3 and then miss out on 1, or you might get 2 and miss out on 2. And then you go write it again, and then you miss out on the same ones, or you concentrate on this part and leave the other part, and then you get the writing and the reading, and then you miss out on the speaking and something else. So if you ask me, I think it's just the English that needs a lot of concentration. For the CBT, very easy to pass. Very easy.
That would be encouraging to somebody.
Very easy.
Yeah. So you did all this was living in England. And
yes. Yeah.
Did you have to find, you went online and found the information, or you go to the NMC website and how did you know that this is the step you need to take, or these are the requirements for you to be able to practice in England?
Okay, so prior to me doing or going through all these processes or procedures, I knew people that had come into the country, even from Ghana, that had already done it. And then there were times that I wasn't too sure. So I just pick up my phone and then ring up the NMC. Listen, I need this. What do you think I should do? Or just go through their website. And it's a very easy procedure. You wouldn't have problems. And like I said, even if you have problems, there are always people around you. To pick up a phone and then ask, listen, this is where I am. What do you think I should do? I got stuck because I got my dates mixed up a bit, filling out my forms, and it became a whole lot of a problem for me. I had to keep bringing up the NMC in and out every minute. That was the only problem I had. But if you have everything okay, you're going to be fine.
So that just reminds me, most people, when they are doing this, they try to do it codedly underground solo. You need to speak to somebody, especially somebody who has already entered the country and gone through the process. Because it's not going to do you any good if you're just sitting in your corner and just trying to struggle. The person living in the country, people call me and I volunteer information and I tell them this and this and this is what you need. Somebody called me, a stranger, I helped her do the whole application. I haven't even set eyes on her. So people should go online, do their research, speak to somebody, because we all have classmates and colleagues all over the world in other countries, for them to help you out. So between the time that you started from the CBT all the way to the OSCE, what time frame? Is it like 6 months, 1 year? How long did that journey take you?
So the English test, which is the OET I took, it took me about a year. Just because when I failed, I thought I wasn't going to do it again. When you study and you put your best in stuff and then they don't really come out well, you feel disappointed. So it took me like a year to do my OET. And it took me like 2 months to do my CBT and then get onto their register and then get a date for my OSCE. So it literally took me like 3 months to finish my CBT and my OSCE.
So ideally, if somebody had passed everything, it shouldn't take them more than 6 months to go towards it.
No, I think the reason why it takes a lot of time is because of the agencies. they tell you they're getting your certificates of sponsorship done. They are trying to sort, your visa out and stuff like that. That's how come it takes forever. If not, it shouldn't take time at all. And then at times too, sorry, the dates, there are no dates. People do not get dates. I remember when I was about to do my CBT, I wasn't getting a date. So I had to travel outside of London to be able to, write my CBT. That is how come people tend to, be late to whatever they are doing. But if not, no, it doesn't take time at all.
The same for the American NCLEX. You have to find a date, and it's sometimes hard to find a date, especially if the time you're ready to write is when all the nursing schools are completing. If they have graduates per year, the nursing schools all over the country book those dates. So you want to structure yours before the nursing students finish nursing school or after they are all done, because it will take you a long time to find a date. So did you need any information from Ghana Nurses Council, your transcript from Anchor Nurses Training? Did you have to bring anything in, and how was that for you? Because sometimes it can be very hard and stressful. I went through it.
So after I had passed my OET, I spoke to a friend. I said to them, I've passed my OET. And then they said to me, oh, you have to do your CBT, you have to do your OSCE. I passed my CBT, and then I'm like, okay, what's next? OSCE, you need your transcript. I'm like, what? When am I going to get my transcript? I rang up my school, and it was like a back and forth something. Oh, I'll get it done for you today. You have to pay this amount, blah, blah, blah. And like, the money is not the problem. Just get it done for me. It took over a month for me to get my transcript. And I got really upset. Like, why? It's just a one-day thing. Just give me my transcript. So yeah, I struggled a bit with my school and the Nurses and Midwifery Council. So if you don't, like I said, if you don't provide the correct information for the Nurses and Midwifery Council, it will be a back and forth thing. I got it mixed up a bit, so I had to keep ringing Ghana Nurses and Midwifery Council also. So the person I spoke to, she was really lovely. She said to me, Jocelyn, I don't want a situation whereby I provide this information for them and then UK NMC would think you're not real, you're not, you don't know what kind of information you're providing. So try as much as possible to ring them up, let them know that you got it mixed up, let them change it before I'm able to complete your clearance, whatever, and then get you sorted out. Luckily for me, I rang up the NMC in England, and then they said to me, it's fine, you provided it, there's nothing we can do. Just let them let Ghana NMC give us the correct information, and then we'll be able to take it from there. So just when I heard that, I rang up Ghana Nurses and Midwifery Council, and then just then the woman completed it for me. Yeah. So if not for me, getting it mixed up with my dates, it wouldn't delay at all. It wouldn't.
So I would like to use this platform to commend the Ghana Nurses and Midwifery Council. I think they're really moving pretty fast, and I love that. Everything is online and all that stuff. The problem comes from your nurses training college or your school where you had your nurse in Ghana. University of Ghana, Kumah University of Science and Technology School of Nursing, all the nurses trainings in Ghana, everybody has a struggle getting an information from them. They keep telling you, go up and down, come this way. And I plead with them to do better and help us out. We've paid our dues, we would love to stay but some of us, we had to live reasons beyond our control, whatever. I hope I'm making sense. So the schools should try and do better for us. We plead with them. When we call them up, they should be able to give us what we need. So this is Jocelyn Boateng. She is a mental health nurse. She originally comes from Ghana, lives in England and works in England as a mental health nurse. So if you're already living in England and you're trying to see where do I start from, you have the right information. So we're going to take it up a notch. We're going to do it for somebody who is living in Ghana as a mental health nurse and wants to practice in England. Where should that person start from? Would the person look for an agency? Would the person start writing CBT on their own? What should someone in Ghana who wants to travel and work in England do?
Okay, so I'll tell you something before I proceed to that. Me living in England, initially I thought, oh, because I lived in England, I don't have to go through the process. I mean, there's something else for me to do. Because you speak to somebody and the person says, oh, just ring up the NMC. They can be of help. But you go to the NMC platform or the website, and then they're like, once you're an international nurse, you have to do this and that and that and that. So I went through the process just like somebody living in Ghana. No difference at all. It's unfortunate that people living in Ghana want to do the OET, which is Occupational English Test, but then it hasn't begun there ahead. It's only a computer-based something, and people are not very comfortable to do the computer-based exams because somebody that reached out to me said to me, I don't know how to type fast. So I said to them, me too. So you start with the English test, which is the OET or the IELTS. That's what most of my colleagues do. They do the IELTS. They can't travel to Nigeria. They can't travel to South Africa to do the OET. So they do the IELTS. And then you do your CBT. And then you come to England and do your OSCE. As simple as that.
So do they need to find a hospital before they start the process, or find an agency before they start the process?
I personally think that you can find an agency at any time because loads of agencies looking to employ nurses, be it mental nurse, general nurse, midwife, whatever. There are loads of agencies looking for you to employ you. But if you get the agency first, there's this lady I speak to. She's passed the CBT, but then hasn't passed the IELTS. And she has an agency that has not promised, but she has agencies, not just an agency. She has agencies that have said to her, listen, just pass your IELTS and then come to England. I think it puts so much pressure on you when you have to find agencies or employers or whatever, when you haven't passed your IELTS. So I think it's fine, it's okay if you pass your IELTS, then you know you're on your way. But for you to just do your CBT and then say, oh, I'm traveling to England, it puts so much pressure on yourself. Oh, I've got an employer. My employer is waiting for me to pass my IELTS, to get my COS, blah, blah, blah. What if you pass your IELTS? There are lots of employers waiting to employ you. So just try and do your IELTS. Just try and pass your IELTS. Then you know you're on your way to England.
So do they necessarily come in any order? Do I have to take the IELTS first or before OSCE, or is there any order it has to follow?
Yeah, so you have to do your IELTS, your English test precisely. You have to do your IELTS or your OET, and then your CBT, and then you can come to England and do your OSCE. The OSCE is like a practice thing, which needs to be done here only. So just do your IELTS, your CBT, and then you can come to England and do your OSCE.
So you've all heard it from a person who is a living evidence of mental health nursing, practicing in England, and people keep asking me, is there a way for us to do I have to be a diploma nurse, or do they need a degree before I can apply? What is the answer to that?
So you don't need to be a degree nurse to be able to get onto the NMC register. I'm a diploma nurse. I'm just in the process of doing my degree. I don't have a degree yet, but I'm on the NMC register. So you don't have to have a degree to be on their register. I was reading on their website and then I realized the nursing associates, I don't know if they are the healthcare assistants in Ghana, the community, I don't know too much. The nursing associates are on their register as well. So you don't need to have a degree to be able to get on there. Diploma nurses are all on their register.
That's a relief for people, because I know this video would be a lot of people good. So after you passed everything, you started working. Did you struggle finding a hospital? Did an agency place you in a hospital?
Not at all. England is always on the move session for nurses. So no, not at all. I didn't struggle at all. mean, there are lots of agencies, employers looking to employ people, even the care homes, the hospitals. So no, it's not difficult at all to find an employer. No, it's not.
Where can a mental health nurse work? I'm sure the same applies for maybe midwife or somebody with a specialty. Do you have to work with NHS? Do you have to work with private care home, or you are free to work anywhere you want?
It all depends on you.
Oh.
You can work with the NHS, you can work with the private hospitals, you can work for the care homes. It all depends on you and what you are looking for and what you want to do. It all depends on you.
So where did you start from? Did you start with where are you?
Previously I used to work in the care home and I've just moved to the NHS. But I'm looking forward to, move back to the care home or join the private hospital again. So I think it all depends on the individual and what you're looking for and what you really want to do. Yeah, if you're looking for money, sorry, the NHS is not a good place for you. I can't hear you.
Yes, I keep hearing that. Is there a reason people say NHS doesn't pay well? So is there a reason? They give you other benefits to subside, to cover up for that, to complement that, right?
So yes, the good thing with the NHS is that when you're ill, you get paid. But when you work for the private hospitals or the care homes, you don't get paid when you call off sick. That's just a difference. But the privates and the care homes are paying some good money, very good money. Yeah.
So I guess if you want the money now, it's better to get a care home. But if you want to save it up and get the maternity and the pension and retirement, then you have to go to the NHS. Okay.
Yes.